Gauri ma'am, thank you for being with me. Welcome to an episode of Nolmë Pod, a podcast by Nolmë Labs, where we talk about psychology, mental health, academia, research, and just anything that we want to talk about, really. Let me introduce you to our listeners/viewers. Gauri Nadkarni Chaudhary ma'am is an RCI registered clinical psychologist who has worked with hospitals previously and is currently working in her own private practice, as well as working as a master's faculty in multiple colleges across Pune. Thank you, ma'am, for taking the time to be with us.
Thank you.
So in today's episode, we wanted to talk about grief as well as grief therapy and touch upon a little bit about suicide and suicide prevention. The reason we thought this episode was important is because many of us have had to engage with the concept of grief, perhaps a little bit prematurely due to the pandemic. A lot of these are young people, and a lot of, I think, unfortunately, there was even to some degree a normalization of death, because many of us knew people who were kind of multiple people who were passing away within a short span of time. And actually, my interest in the topic was particularly like a little bit of an anecdote here is I have a friend whose husband passed away. He was an army man, and he passed away during an operation in Kashmir. And even though I had never met him, I felt immense grief, particularly on behalf of my friend, kind of maybe in concern for her. And then also just the fact that they are young people and they had their whole life ahead of them and things like that. And then a couple of months later, I lost relatives during the pandemic. And it seems like many members of my family were very matter of fact about it. They were like, that's life. And maybe they were expecting it. And that really made me wonder about grief a little bit more deeply, and whether it's quote unquote normal to grieve for somebody you didn't know versus be very matter of factual about somebody who was family. So could you tell us a little bit about what is grief?
So one thing we need to begin to understand is grief is a very normal, it's a very biological process to begin with. If you've seen not just humans, but even animal societies like elephants or higher mammals have a grieving process when they lose a member of the herd. Grief is an inbuilt process. And if I have to put it in simple words, grief is very much similar to the healing of a wound. Right? When you get a wound, it hurts for a period of time and the body takes over, it starts healing and you have a skin growing and eventually it merges with the body. And it's not that it goes away completely. Probably the scars do remain, but you learn how to live with that wound. You learn how to adapt to that. And that is exactly what grieving is. Not about detaching from that person, not about forgetting that person, but it is about learning to live without that person's presence in your life. And it is also about adapting to a new life which is without that person, where that person's physical presence is not going to be there. A lot of times when people talk about grieving and getting over somebody's loss, they talk about forgetting and not remembering them. And if at later point they do get memories, they feel that they haven't grieved. But that's not true. Grief is, you will miss them. You will miss them because they were a part of your life or you were attached to them. But you will learn to accept it. You will learn to live with it. You will learn to live with that pain. And that is what is grieving. And that is what is a complete process of grief. The other point that you mentioned, that you grieved for someone else whom you had not even met possibly versus somebody who was related to you. So grief is not just about, it's not just about who it is also about the level of attachment that we have to that person or to that concept for that matter. So sometimes we grieve for maybe a loss of a house, or we can grieve for a loss of a position. It's more about loss, a sense of loss, than a person passing away. You were grieving for the friend who had lost something very invaluable. versus grieving for a person where you feel that, okay, it had to happen at some point of time, or it was a loss that is something that I already knew that I might lose. And it's not that it didn't hurt, but maybe it didn't hurt as bad as you would have expected it to. And attachment and loss is something that we have to keep in mind while grieving.
Or even when people grieve for celebrities, it's very strange.
Yes.
Probably because they meant something to us in a personal capacity.
True.
Yeah.
And probably because we identified something in them. Like, for example, if you remember during the pandemic, we lost Sushant Singh Rajput to suicide, which was something that a lot of people mourned because he represented a young, successful male who had all the reasons to live and no reason to die. And for him to take his own life hit a little bit too close to all of us. And that is why it did affect people a lot.
Right.
It's more of what it represents to you, human being who is willing and who has a lot of success and money, which we think are all life is all about at a particular age. And when that person is no more, then you suddenly feel an existential crisis to see what is life about if this person is to go away.
I think that's very interesting because my next question was about how all deaths are perhaps not equal in the experience that we have while grieving for them. So there are people who will die a natural death after living their lives. And then there are others who die too young, perhaps in case of accidents or when a young person dies, then I think the experience of grieving for their families or their parents is a very different experience for like in the former. So is all grief equal? Like in that sense, is it all comparable?
No, see, grieving is a very, very personal process and it cannot be equal. Let's say in terms of even natural death, let's say parents. Now, all of us have this fear as we grow older about losing parents. But the way we grieve for one particular parent may not be the same way we grieve for the other. And it has probably nothing to do with the attachment, but it is also how it happened, how close you were to that person, whether you were mentally prepared for that kind of a thing. Or like you said, grieving for somebody who went away too soon or unexplained. Then there is another level of grieving because now you have to accept that this person is no longer there and there is no logical explanation for that, of why it happened. See, grieving is a lot about finding whys, the answer to why. Why did it happen? If I have a natural answer that the person was old or the person was suffering from something and the person has passed away, I know that there is a logical reason for this. But when I'm not able to make meaning out of death or meaning out of loss for that matter, that is when grieving becomes a little difficult because I am not able to find meaning. Especially not just young people, but for example, if somebody older loses somebody younger, like a parent losing a child, now that is against the natural procession of things. And that becomes difficult for the older generation to accept that how can somebody overtake me, if I can use that word, that I was supposed to go first and now this person is gone. Then finding meaning and purpose in life becomes very, very difficult.
And even their expectation of how their lives would have panned out. That might be a constant reminder. Like if somebody dies very young, then every time there's maybe a graduation season happening, or every time there's a time when somebody was supposed to get their first job. So all those sort of milestones are very attached to that, the meaning that person held in our lives. Very often I've seen as we age, we kind of get acquainted with grief a little bit more. But I've seen a lot of people feel guilty for presenting a life that is happy, which is against the expectation that others might have of them. So I see a lot of guilt in people, especially presenting happiness on social media. Like students I've seen who've lost somebody very close to them, a loved one. If they post memes, it comes with a lot of finger pointing. Is that healthy, and how do you cope with that? Because so much of our lives are about presenting a version on the internet.
Actually, I've seen in recent times two aspects of this guilt is when you start getting over someone and you suddenly feel guilty that how can I get over this person soon? Why am I happy? Do I deserve to feel happy, or do I deserve to live my life if this person is gone? And why am I healing? There is that guilt of, is it happening too soon, or is it happening? Did that mean that I did not value that person a lot? The second is, unfortunately, grieving is not something that we have accepted as a society as a whole, especially gender wise. If you have a look, that we are not very open to men grieving as much against women grieving. If I'm grieving, I may also feel guilty about grieving and feel that no, I should not show my personal grief to someone else, especially the world outside, and it should be something private and I should mourn in private. And that is why they then try to gloss over their grief and show a picture where they're all happy and accepted, and things like that. I feel it's more to do with how you understand grief and understand that it's natural to feel something, it's natural to feel sad, or it's natural to feel upset, but it doesn't have to follow a timeline. It can be different for different people. Like the example of wound I gave, it's different from different people. How much time my wound takes to heal versus yours could be different. And if we can accept that, then we should also accept that grieving can be different and it doesn't have to follow a pattern. So there's no guilt associated with it.
And just because somebody doesn't seem like they're hurting doesn't mean that they aren't. They could be feeling pressure to grieve privately, or they might not even be feeling pressure. They could organically just be private people.
Yes, yes.
So we talked about how grieving is a natural, normal process. It's a part of healing. But at what point do you feel that somebody should get help? If, like, when should they go to a mental health professional or a professional to kind of aid in the process of grieving well?
See, ideally, grieving, if you look at grief counseling and the studies related to grief counseling, it's not something that we will intervene in normal grief. Normal grief is defined where you take about 6 months to grieve. You have various ups and downs, and you take your own time to grieve. And most people should be allowed to grieve the way they want to grieve. There is no set norm that this is how grieving should be. So there are some people who grieve very, very verbally, very loudly, very obviously, and that is okay too. There are some people who are very private in their grief, and that is okay too. For example, you were talking about social media. Now, I can grieve by putting positive photos or positive memories with that person, and that could be my form of grieving for that person. Or I could just block all social media and grieve. That is also fine. At what point you should seek help is when it starts to affect your day-to-day life, when it starts to interfere with what we call a socio-occupational functioning, where you're not able to function, where it starts affecting your biological functions like your sleep and appetite, or you develop unhealthy coping mechanisms, like, let's say, like using a substance or getting addicted to internet, or it's called masked grief, that it doesn't come out as grief, but it can come out as anger episodes, or it can come out as binge eating episodes. That's masked grief, where you've denied the grief and it's coming out in other ways. That is when ideally you should approach a mental health professional, that it's now going beyond my capacity to deal with it. It is
occurring in life,
in my socio-occupational functioning. Earlier on, we used to talk about 6 months period, 1 year period, where you consider normal grieving. But somehow now, even research has shown, or even clinically, we've seen that there is no timeline. You can't put a timeline to grieving. But at any point where you feel like it's like a backache, at what point do you seek help for a backache? Is when it gets too much to bear. It's the same way. Grief is when it's too much to bear, you seek help. Maybe you just go there and went about it. But at any point where you feel that, no, this is not something I can deal with, that is when you seek help.
And what sorts of professionals are available to somebody who would want to seek help specifically for grief therapy?
So there are trained grief counselors who would be psychologists who are just grief counselors. There are clinical psychologists who are trained in grief therapy, the various types of grief therapy. In cases where it is turned into depression or substance abuse or something which is diagnosable, then possibly a psychiatrist can also be involved for the use of medication for some period of time. But generally, going to a clinical psychologist or a grief counselor is sufficient for most people.
And you mentioned depression, which I've seen a lot of people use the word depression interchangeably with grief. Are they the same thing, or?
No. So grief is more about someone else. It's about the loss that I feel about someone else. Whereas Depression is more personal, where you feel you can't go on, where you feel a sense of helplessness, hopelessness, where the mood is pervasively sad, like there is no source of happiness, or there is no point where you actually feel good about yourself. So no, grief and depression is not the same thing. Grief sometimes can lead into depression, but not all grief is depression.
So there may have been a pre-existing predisposition to be for depression, which now is coinciding with grief.
So grief, like you said, could be a trigger, or sometimes when it goes unresolved for a very long time, or during grief there are multiple stressors that have happened, like during COVID we saw that somebody lost, let's say, a husband who was also the breadwinner. Now the person is not just dealing with the loss of the husband, but also is dealing with the additional financial stressors, or what comes around with it, the stigma of being a widow or whatever. All this could then flip into a depression, but that's not always true. Not all grief, or most of the time, grief will not lead to depression.
This is a question that's coming more from a therapeutic perspective. But because there's, like you mentioned, there are people with a master's in counseling who might have specialized in grief therapy, as well as there are clinical psychologists who have further training and maybe training within the clinical psychology program where you address grief in particular. But honestly, I mean, the way that things work in India with the lack of regulations, I mean, there are people with a lack of experience or who have just completed their education, maybe without supervision, are taking on clients because they can after a master's. But what are some ethical issues that kind of will present itself while taking on a client who is grieving?
See, one is grief counseling is not easy. It's not easy even for a professional, because it touches something which is our core fear. And it is something which is emotionally draining when you're talking to somebody who's grieving, because death of a loved one is a reality for all of us. We have to be very, very careful that we are equipped, not just from a training point of view, but also from an emotional point of view, to take on a client who's grieving. It cannot trigger your grieving on your own, and then it kind of messes with therapy as well. Not just training, but your emotional state at that point is also important. Second, remembering that you are not there to change their idea of death. Like, we all have an idea of death, what happens after death, or what happens to a person who's died. And to say that no, the person goes on and the physical presence is not there and whatever. You have to work with their idea of death, and you have to work with what they originally believed about death and not change their idea of death. Second, you also have to remember that here you are dealing with not just somebody who is suffering, but who is probably feeling lost and helpless. At any point of time, you feel that, no, I don't think I can take on this person, or I don't think I can help this person. You have to take that conscious step back, that I will not mess with somebody's emotions further. See, a lot of times we think grief counseling is about preaching and telling them it's what to do and what not to do. But sometimes it's just about listening. The most common mistake people tend to make is tell them, don't cry, things will be fine and everything will be okay, which is not true. Everything is not going to be okay and everything is not going to be fine, because they've lost a significant person in their life. So remembering not to say that, remembering not to interfere in their natural healing process. Human beings are biologically equipped to deal with a lot of things, especially death, because again, it's biological. We are equipped to deal with it. Interfering with a natural process is not something that you should. It's like, I keep coming back to physical examples, but an orthopedician will not interfere with the bone healing on itself. He just puts a plaster on it to give support. That's exactly what a grief counselor does. That, you let the body heal. You're just there to give support. You're just to ensure that the healing is not happening in a way which is detrimental to that person. Otherwise, nature will take care of its own.
So it's then advisable to take on further training even after a master's to specialize in grief therapy.
Yes, not just masters. If you have not had that training at any point in your career, like even after your MPhil maybe, or in your PhD, you've not had that kind of a training, it is advisable at least to go through some certification, some training program, because it is something that not all of us have dealt with. It's not something that we've always seen a lot of clients with. So, and supervised training or a hands-on experience is something that is advisable before you take on grief counseling. Like I said, not just because for the client's sake, but for your own sake as well, because it's not easy. It's really, trust me, it's not easy to do grief counseling because it's very, very emotionally draining. So it should not affect your mental health as well. For that, at least you should take that training.
And I think what you said about that, that grief can, it's not just, I think a lot of people think that they can take on cases because they're only seeing the presenting problem and not the potential that presenting problem might coincide with something else like depression or another disorder. Maybe that greater insight might come from the specialized training.
Yes.
As a support provider, not as a counselor or a therapist, but as a family member or a friend, what are some good ways in which we can provide support to somebody who's grieving, say a friend or a classmate?
I think the first thing that we as friends or family members need to understand that grief is very personal. How a person grieves is their choice. You can't force a person to grieve in a particular way. Like we have either this misconception that don't cry, or we have the misconception that they should cry. So it's okay. Let the person deal with grief the way they wanting to deal with. There are some people who just want to talk about that person over and over again, and we feel that this is not, but that's their way of feeling, and that's fine too. And there are people who just don't want to talk about the person who's passed away, who want to deal with grief as if nothing has happened and want to get back to normalcy, which is also fine. The one advice I would give, especially related to males, is that you tend to tell them that you have to be strong for your family now, you have to take care of your mother or sister or your wife or whoever it is. But it's a little unfair. They are also human beings. You have to allow them to grieve. There will be a lot of cases, especially during the COVID times, where the practical aspects or the legal aspects, getting a death certificate and changing the bank names and all, takes much precedence over emotions that the person doesn't have time to grieve. I've heard many people say that I didn't have time to grieve. Why? Because they were running around doing these kind of things. If you can help somebody take care of these aspects and give them time to heal, just spend time with them, doing whatever they want, ensure that they are eating well or they are sleeping or they have all the practical things taken care of, I think that will also be of great help.
Actually, that's an interesting point. Like whenever somebody dies, there is many rituals, especially in a religious setup. And I was told that the rituals are sometimes maybe not intended for that purpose, but they are beneficial in that it keeps a person really busy. A lot of people might rely on the busyness to not immediately cope with the reality.
True. See, the rituals, the 13-day mourning period, most religions will talk about that time frame to feel better. If you saw during the pandemic, a lot of these people went through complicated grief because they didn't get to do those rituals. They didn't get to bury or cremate or whatever. They didn't get to say a final goodbye. Right? That rituals are at times helpful to get it out of your system or get a closure or feel that the person is now free, moved on to the next world or whatever they want to believe in. But that absence of rituals could also be problematic. But at the same time, if the rituals are enforced, that's something that you have to do because of whatever, and it starts interfering with your grieving, then also it can be a problem. Like I said, it's a very individual thing. Let the person do what they want to do rather than forcing them to do what is expected. I would like to point out that we've studied stages of grief, that grief has denial and anger and those, which may not necessarily be true. I may skip a stage and then I feel, oh, I skipped that stage. Am I grieving properly? I may just go from denial to acceptance, not to the other stages. But that's okay too. It doesn't mean that I haven't grieved properly. It's not a linear thing. It is something that is very, very individual.
That's actually really important because I think a lot of those models for how any emotional processing works may be a very Western model, or they might be based on perhaps a type of empirical information that makes contextual sense. But they may not directly adapt, and it's not a linear process, especially for our context.
Yes, yes.
Actually, there's two questions that are kind of important. Very often there are children, especially during the pandemic, there were a lot of children who were orphaned,
Yes.
and a lot of their very immediate concerns became their well-being as well as their, like, how they'll navigate life after this. What are some special considerations for a child who is grieving from a therapist's perspective?
See, I think one way to take the age of the child into consideration, obviously. Second, the child's understanding of death. A child who is about 2 years old understands only a physical presence. It doesn't understand that, when a person is not physically present, they may continue to be there. But as you grow older, towards 5, 6, 7 years, you do have a concept of death, especially now because of the media and what is being talked about death. Understanding the child's concept of death, understanding the child's concept passing away is something that we need to take into consideration before we start any sort of therapy with that child. And again, helping the child develop attachment patterns with somebody else now. Because if, like we're talking about parents, they were the chief sources of attachment. And now that attachment is gone, and I have to make new attachment patterns. Sometimes what happens is the person, like let's say the grandparents are taking over the parents' role. Sometimes they go overboard because the child has lost a parent. I will not set boundaries, not set limits, and then give in to everything that the child says, which is not going to be healthy for the child. The child, you should try and deal with the child as normally as possible, that then the child learns to form attachment patterns. At the same time, we have to also remember that you cannot take over the person's role, the person who is lost. And sometimes in our effort to provide care, you tend to become their mother or become their father, which you don't have to. That child will always hold that place for their parent. But you are somebody who they can have an attachment pattern with. You can take over the role of a parent, but not become one. And that is somewhere I think is a therapist's job as well, to explain to the person, the caregiver, that this is something that you have to keep in mind. Because I have seen a lot of caregivers feel bad when the child says, "You're not my mother, you're not my father." And they feel that they're either lacking or they feel angry. But that is the child, and that's how they are dealing with things. And you should let them make their own attachments rather than force something on them. A lot of times, a child may not even realize he's grieving, but it comes out through their play, it comes out in the way they talk, it comes out in the way they react to certain situations. And it is at times necessary that you be vigilant of these things as friends or whoever, that they will show signs of grieving. Or sometimes what happens is you don't speak about a particular thing in front of the child, or you don't talk about death in front of the child, and the child starts feeling excluded. But encouraging the child to ask questions about death, encouraging the child to say that, yes, I'm missing that person, and it's okay to miss that. So, like, for example, the child lost a mother. The husband also lost a wife. Saying the saying that I miss my wife, or the father crying, or the father saying that it is not going to be same, it kind of validates the child that it's okay to feel like that. And I don't have to be strong for my parents, or I don't have to be, this child, because the family is grieving. Right? Or not forcing the child to grow up faster, because I've seen, like, the elder sister or brother being told that now that your parent is not there, you have to take care of the younger sibling. Become a proxy place. So, which is not fair on that child as well. We have to ensure that we don't do these things, and maybe the child will grieve normally and get over it. Yes, there might be decline in academics, there might be some behavioral problems, but that's normal part of grieving, and they will eventually grow out of it. But this is something that we have to ensure that we don't do.
And like you said, a younger child may not have the vocabulary to express their grief, and hence maybe a therapist might use perhaps projective tools and techniques that might be useful for.
True.
Like I'd said previously, you used to be my go-to person to kind of redirect. In the teaching profession or any profession where you're facing masses of people, every year there would be perhaps a few students, especially during the pandemic, who would voice that they were thinking about self-harm or suicide. And I remember my response as somebody who felt accountable at that time for these students was immediate panic, because it's such a like, I'm always thinking worst case scenario, and I would redirect the students to you or anyone who's in their immediate vicinity. I would ask them to contact you. I thought it would benefit us to talk not just about grief and grief therapy, but also to talk about suicide and suicide prevention, particularly for the student community. And I think my first question would be, like you said during the Sushant Singh Raj, like when he died by suicide, one of the major conversations happening in the media was whether or not he was depressed.
Yes.
And I think I've seen this very often, is that there is, like, in the general perception, in the public perception, there is a thought that suicide is always associated with mental illness or depression. Is that true?
See, suicide is an extreme step that a person takes, not necessarily when they have a mental illness. Mental illness, of course, is a cause, not denying it, but it is more to be associated with hopelessness and not necessarily with depression per se or a mental illness per se. But when the person loses hope of something or finds no other alternative, that is where the farmer suicide thing, which was a big issue, continues to be a big issue in our state especially, was not because they were depressed, but because they didn't see a way out. They were hopeless and they couldn't see things improving. Either a lack of purpose in life or a complete hopelessness is what leads to suicide. Now, when we talk about suicide, we need to understand that suicide can be impulsive. It can be a well-planned thing as well. Suicide can also be a cry for help. And an attempt to suicide is also a cry for help. I'm not able to deal with whatever is happening, and it could just be a cry for help. We need to understand that the person may not show signs of very obvious depression, may in fact be in therapy, show that he's getting better, but could be impulsive, a reaction to something where he or she felt completely hopeless. It's more about hopelessness than about just illness.
Depression or mental illness. Actually, the point you made about Vidarbha and suicide, that's very important, because I've read that suicide is often a multi-sectoral issue. It's not simply associated with emotions or mental health or as a causal factor. There are many contributors, and hence the risk factors might also have to do with a person's socioeconomic background. And there was actually a study, there was a policy change in a country, I don't remember which one, that made tangible, like it had tangible impact in reducing the rates of suicide simply by enabling cash transfers into the bank accounts of people who are below a certain line. So that kind of tells us that it's not always going to be, of course, everyone should go to therapy if they have the means, but often it's going to be resolving the triggers that.
True. And I think more importantly, creating awareness about suicide is very, very important, because a lot of times we have many myths and misconceptions that why would somebody like him kill himself, or why would it's a coward's way out, or whatever it is. But see, survival is our basic instinct. It's there since birth. To get over that basic instinct and to harm yourself, that means you have suffered much that you are taking this extreme step. So it has very little to do with cowardness or finding an easy way out, and it is more to do with an inability to see beyond a particular point. Suicide could just be biological, it is behavioral, it's emotional, it's everything. And if we have to reduce the number of suicides in our country or in the world per se, we have to tackle it at all these levels.
Right.
And not just say that, okay, we'll make mental health accessible. Yes, that will help. When do you seek help is also something, not after a person has attempted. Not there is a first attempt and realize that, okay, maybe we need to take that person. So there is an episode of self-harm and then you approach. But preventively work towards understanding what is taking that person to that point, and then working on it preventively rather than firefighting.
Right. Actually, what you said about taking the coward's way out, and even during celebrity suicides, I think one of the unfortunate things that happens is that people who want to deny that this person could not have died due to a mental illness, or they don't want that narrative out there, they accidentally end up disparaging persons with mental illness in the process by saying that no, this person could never have had depression. They were happy,
Yes.
they were productive, they were good members of society.
True.
And that can do much like collateral damage to others who are perhaps currently struggling.
Yes.
Right.
No, so see, that's what I'm saying, that we need to understand that it's people generally associate again suicide with, poverty or lack of means and things like that, but it is not true. It is, and I'm not saying it's an equal distribution, but it is at least an equal reality across sections of life or across class and caste and everything. Why? Because life is across caste and class, and when you don't find a purpose in life, then you suddenly realize that it doesn't matter whether I have all the money, because I'm not able to find use for that money. So it's not just about he had a good job, he had a family, he had XYZ.
What do they have to be upset about is the common.
But I could still have everything and not have the will to live, is something that we have to make people understand.
What are some things that a person in the immediate vicinity of somebody who has attempted or is contemplating self-harm, like what is something that that person can do?
See, the first thing that we need to do, like you said, not panic and not take it completely upon ourselves to prevent that person. But the first thing that we need to understand is not to minimize that person's problem. We have this tendency, that there's so many others suffering in the world. Why do you have to do it? What kind of problem do you have? Is this enough reason for suicide? Let's not make it for reasons. What we need to do is just not get angry or scold him or belittle that person, but just understand why this person is saying that. Okay, not react in ways which makes them feel guilty or terrible about it, but make him understand. The second that we need to do is not, like I said, call them names for having these thoughts as well, or we tend to call them selfish. Didn't you think about your parents, or didn't you think about your children? They did, and that is why probably they're doing something like this. So that is one thing that is a absolute no, that don't do that. The third most practical, or the most practical thing that you would do is try and reduce means that are available, like knives, and not leaving the person alone, or access to something which they could use for self-harm. And I'm not saying that you hover around that person 24/7. That's not possible. But at least be with that person. That person, like I said, survival is our basic instinct. That person does have this thing that I want to talk to someone, or I don't want to die. You are at least available to them, talk to them, encourage them to call hotlines. There are suicide hotline numbers available. Call them. Then at some point, take them to a therapist or a doctor, or whatever at that point is needed. But I think keeping your wits about you and not making that person feel bad about having that thought are the two most important things that we can do.
I think the first point that you said that's extremely common is a lot of people coming from a good place might try to trivialize that, they think they're helping the person focus on the positives, but actually they're perhaps further distancing themselves and making it apparent that they don't understand what that person is going through, and might further isolate them. I think one of the questions that I haven't really listed down, but since we started this conversation talking about celebrity suicides, is what can we do to engage with media, both at the social media level as well as at the news, or in terms of popular media? How can we engage with suicide more responsibly? Like, I'll tell you where this question is coming from, is that there are media guidelines that are published, like news channels are supposed to not give the means of, or not give, make assumptions about the person's reasons. And then I saw the movie Gahraiyan, which was praised a lot for showing survivors. But it also showed cases where the entire process of, the entire decision making to the means of suicide was depicted. And then in another movie, I think there's a movie where Ranveer Singh is jokingly telling somebody that this is not how you slit your wrist, this is how you do it. And then he's showing the correct way to do it. That's very irresponsible. What are some things that we can do at the media level?
I think The one thing is, like you said, responsible reporting. Okay, not we all have this morbid curiosity of seeing the body or getting to know the details about it. But unfortunately, too many things are readily available for children. I have had children as young as 5 and 6 tell me how to kill, how they can kill themselves, and which is very sad. And that probably comes from too much knowledge, too much, or I won't call it knowledge, too much information, which is misguided. Responsible reporting, reporting about not just not reporting about the means, but also reporting about how you can overcome this, and how it is something which can be dealt with, and what are the ways of dealing with it, right?
Right.
In these, generally, if somebody talks about suicide, it is more about how you guilt trip that person or call that person selfish and all those things that we don't do, right? Or suddenly it is glorified then that this person committed suicide, and that is why the hero became one. So instead of glorifying that, if we can actually talk about mental health and how this person then sought help, either from a professional or a friend, and then worked his way out of that would help. And like you pointed out in the beginning, not making assumptions about somebody's mental health, not making assumptions about the reasons why somebody would take their life. And then we saw a huge increase in the number of suicides post this whole Sushant Singh thing, because it kind of validated the fact that people could go ahead and do things, and
it made it seem like an accessible reality for a lot of people who may have been on the fence.
Correct. So, like I said, improving awareness about not just mental health, but ways to overcome it. Like, there is help available. There's a lot of help available.
So highlighting the solutions would be a good way to
or the process of solution, not just the solution, but the process of solution. It's a process. It's not that I feel suicidal now and next moment I won't. It's not that, right? There's a process that you go through.
If we could talk a little bit about student mental health, because I think, as with the conversation with grief, suicide is, I think it's quite prevalent. At least the thought of it may have occurred to any child or adolescent, even perhaps during the teenage years. Why do you think that is? Like, my own hypothesis is that it's slightly, the permanence of death is not fully understood.
True, permanence of death is not fully understood. Hopelessness is something that is very common in that age, because you don't have a wider range of responses. You feel that, okay, this is it and I have no way out. That plus peer pressure or pressure of the family to behave or perform in a certain, that kind of increases. See, adolescence is a lot about self-worth, and these are your formative years when you are forming self-worth. And if there is something that is affecting that could make you value your life even less. We have to work on improving the self-worth of the youth. It cannot be dependent on how you look or how many marks you score or whether you have a particular vehicle or whatever it is, things that are important to them. And it cannot be validation from others. It has to be something that comes from within. And that is when you start respecting your life or your health, for that matter.
Right.
And this one way of preventing the immense pressure that our youth feel these days, because they are so pressurized to prove themselves. I was just telling somebody the other day, there's a 15-year-old who told me, what have I achieved far? And I asked her, what did you want to achieve at the age of 15? There's nothing you can achieve. You're just building yourself. Achievement comes in much later. But there is a guilt of having done much in life at the age of 50. See, the amount of pressure that we feel at that young age, then it is going to be difficult. Second, I think somewhere in our syllabus, somewhere we need to talk about stress and coping. What are the healthier ways of coping with life, healthier ways of dealing with stress? Unfortunately, there are two things. Either we have inadequate coping resources, or we've never been exposed to stress. Parents or whatever have been protective, that I've never dealt with rejection in my life. I have never failed in my life. I have never scored bad marks in my life. And then when you go ahead and something like this happens, you do have a rejection, then it suddenly becomes too overwhelming for you to deal with. Like for somebody who's been topper, let's say to 12 standard, now gets into IIT and suddenly realizes he's not the topper anymore. It is end of a life kind of a situation, because they've never dealt with that kind of a situation before. improving coping, giving them a fair idea of what stress could be. And it's okay to be stressed out at times. It's okay to feel overwhelmed at times, but there are means of coping with it without resorting to substances or other things.
Maladaptive means
Yes.
of coping.
Yes.
I think one thing that we did touch upon, but it is during those years when we are students that we also have perhaps the least amount of agency in our lives, because we're either accountable to teachers or parents, or maybe we're not financially independent. And I'm guessing that could contribute to the feeling of being stifled. Like when the 15-year-old you mentioned is saying, how much have I achieved? Much of what that person might be going through is not in their control now, but they may not realize that. There's a lot of personal accountability. I'm sorry, I'm not a therapist. I shouldn't be hypothesizing. I just related with that.
Yes, true. And it's like, somewhere you are at that age where you feel a lot of things and then you suddenly realize you don't know a lot of things. And unfortunately, especially in our country, we are going through this transition where we are neither the East nor the West, and the parents are from the parents always will be from a different generation, but they are also going through what is acceptable and what is not acceptable and things like that, right? Somewhere, I think a dialogue or communication between the family, which is unfortunately not happening these days because of various reasons, is something that we need to encourage. Setting boundaries, not just for the child, but for the parents. Like 15-year-old is not going to share everything with his parent, is something that the parent also needs to accept. And then forcing the child to share everything is not needed. But somebody had said to me that I don't need my mother to hold my hand when I cross the road, but just knowing that she will, if I need it, is enough for me. Which is very, very true in life as well. That you don't have to mollycoddle the child, but know that the child can come to you and tell you that I made the biggest mistake in life, and you will still support them. Right? Is enough. I don't hide something from my parent. I don't have to hide something from my parent. And even if I make a mistake, it's okay. My parent is not, or whoever is not going to abandon me because I've made that mistake.
Right.
Yes, they'll scold me, they'll punish me, but they will not abandon me. That sort of attachment is what we need to inculcate in the child.
And I'm not sure if this is like the thing to say, but a lot of times when students have come up to me and it's become apparent that they're not telling or they're hiding something, like maybe a failure or maybe a dangerous situation that they're in, and they're hiding it from their parents, I have felt the urge to explain to them that your parents will have your back irrespective of, the depths to which you have, you think you've fallen. Like your parents' first instinct is going to be to have your back. And like you said, they might scold or they might punish or you might be grounded, but their first concern will be for the child.
Correct. Yes. Yes.
Right.
And a lot of times adolescent suicide is about this misconception that their parents will react badly, and then they realize that they did. So I'm not that all parents are, that rational, but at least it's worth a shot to see what happens and take the parent, any adult who would trust. It may not be a parent, it could be an aunt, it could be a friend's parent, but some adult who would help you out in that situation.
Right. And I think you mentioned earlier in the conversation that suicide happens because a person cannot see beyond a particular point. That is super important, because many times the finality of the situation you're in can seem much more inflated in our own heads. But there are many times where imagining that this problem you have surpassed, however difficult or however long that took, I think that can really help to kind of not limit your imagination to this being the worst problem in life.
Yes. Or not able to find a solution doesn't mean that there isn't one.
Right.
Talking to someone always helps, because they might give you a solution. And it doesn't necessarily have to be a therapist. It just could be somebody else who's, looking at it from a different perspective.
Yeah. When it comes to preventing student suicide in particular, like we said, suicide is a multi-sectoral issue. There are things that we can do at the personal level as support providers, caregivers. There are things that teachers can do, including therapists. But what is something that institutions can do to kind of prevent suicide?
Having a counseling center or a counselor, somewhere where that person has the confidence that it'll be confidential. I can go say anything that I want, and I will be heard. I don't know if you've read a book called Man's Search for Meaning. It's
Right.
more based on existential theory. And there was this woman, she talks about that she spoke to that person for 1 hour, and finally she said that, okay, fine. If in a way, in this world, there is one person who's willing to listen to me for 1 hour, then there is something good in the world. Or to take a popular reference, if you've seen the series Friends, there is an episode where this Phoebe character, she's doing telemarketing, and there is a person who's attempting to kill himself, and she talks to him and shows concern. And the fact that she showed concern actually gives him a will to live. Yeah. So just having someone who will hear you out without passing judgment or without making you feel that you are doing something extremely wrong is enough. So if institutes could have just somebody who the person can anonymously approach and talk about what they're feeling, it would help a lot. It doesn't have to be a mental health professional. It could be anybody, a person, assigned person who knows that I will be non-judgmental and I will keep that confidentiality bond and listen to that person.
I think a lot of times there have been counseling centers, but it's not publicized amongst maybe students outside of the field of psychology. So
yes,
I think publicizing that there is a counseling center and periodically making sure maybe in an orientation to students of some sort at the FIBA level would help, that this is a place that you can go and inquire about any sort of support.
Yes.
What else can we do, like outside of an institutional setup? Like what else can we do? Maybe reducing stigma is definitely one.
Yes.
The stigma of suicide as well as mental illness.
Yes. And like I said, that spreading awareness. We have this misconception that people who talk about suicide don't commit suicide. Or, there's certain categories of people who will never commit suicide. We've heard this. He was not the kind I thought would kill himself. Things like that. But spreading awareness, tackling those myths is something that we really need to do, because with the kind of exposure we have about suicide, we need to have an exposure countering it as well, increasing awareness about it as well. And the more people are willing to openly talk about something, the more people are willing to take help. Like how over the years, if you've seen, people are willing to seek help for addiction, because now it's okay to say that I have addiction and I'm working on it. So if we can get that, or over the years that has happened with depression as well. I have depression and I'm seeking help for it. If we can do that, okay, that I am having suicidal thoughts, I will, if I will not be judged, then I'm okay with at least seeking help for it. But if I feel that I'll be judged for having these thoughts, and then I feel the need to hide it from people, then there are some people, students who don't want to tell their parents they're coming for therapy because they don't want them to know that they are having suicidal ideas, which is really sad. Right? If we can talk about it only we can normalize that yes, people can have these thoughts and it is okay, and there is help available, then a lot more people will seek help.
In April, I think it was Suicide Prevention Week or month, I'm not sure. But one of the things that Nolmë Labs had done was platform the voices of people who had attempted suicide and then changed their minds at the last second. And this was, of course, through text posts to maintain anonymity. But it would be great if people could talk openly about previously having attempted suicide. And then what made them change their minds. And through all of that, through all of those stories and narratives, one thing that was frequently occurring is a concern and love for their family members, knowing that my parent will not be able to withstand the thought of me dying. Or it was very often concern for others that was kind of, and I found that really interesting. But also a little bit like that pattern was a little interesting, because you should want to live for yourself also, not just out of a concern for the other person.
Yes, true. And that is something that we keep telling people who come to us, that yes, it will affect them, but more often than not, it will affect you as well. You're not just depriving them of a child, you're depriving yourself of life and experiences in life which you could go ahead and have. Yes, family is a supportive factor. Family is probably one of your reasons for existence, but it cannot be your only reason for existence. There have to be other things as well.
I think this is where we can pause.
Yes.
Thank you for doing this, ma'am, for taking the time out. I really hope this will be useful to anyone watching, especially students.
Yes.
Yeah.
Thank you. Thank you so much.